This meeting is being recorded.
Good afternoon, class. Good evening. Welcome to our first webinar for Global Integrated Behavioral Health. Feel free, if you'd like to turn your cameras and mics on. It's a small class in terms of attendance right now, but if you want to leave yourself muted and/or camera off, that's certainly fine too. I like to do my webinars more as discussions as opposed to lecturing. So I really expect your input. Interrupting me is fine. I may mute you if you have some background noise, but I'll unmute you if you want to talk, certainly. And welcome to the class. I'm going to talk about the course today, go over the syllabus briefly, talk about how to approach the course, how to be successful in the course, of course, and answer any questions you may have about the kind of content you're thinking about doing for your project for this course. So welcome. I always spend a few minutes before each class playing some music. I try and make the music central to something happening either in the course or in the world news. And I had played some African folk music today. It's kind of funny. I clicked on just on YouTube, African folk music, and the first one sounded kind of hokey. So I looked at the comments. People were saying it sounds like a Disney version of African music. This is African pop. So I quickly changed and found something more authentic. So beware what you look for on YouTube there, but I think I found something good in the end. Any questions before I jump in and start today? Comments? I'll jump right in then. So this course should be fun. Now, it's a summer course. Many of you are busy in between fall and spring sessions, or spring and fall, I should say. Busy working, maybe even doing some vacation time. This is meant to be a fun course. Of course, it'll be a challenging course in terms of the expectations for the assignments, but I think it's a course that you'll enjoy as you learn about a country you select for the course to study and do a project on. I do want to go over some information about the course. This is my first time using the Canvas platform. I always use Blackboard for my courses in the past, so I'll apologize in advance for any mistakes or problems I have using Canvas for the first time. So far, so good in terms of navigating things. And I think it's a good platform. I'm looking forward to using Canvas rather than Blackboard. I'm sure for some of you, you've been using Canvas for one course before, perhaps. If not, it's your first time using it, we'll go through the same learning curve together. Do take time to explore the Canvas instructional link you have. There's all kind of written and video information about using Canvas, really easy to follow. Almost any kind of question you need help on, you can find on the different tutorial materials. And if you're stuck, always go to the ASU help desk. They have a special help desk you can select for Canvas. I had a problem on one of the things I was trying to work on yesterday called the help desk, and they were great. So don't be shy about using help desk. And last of all, you can always use the hallway discussions community forum in this course for any kind of questions for the group. And when the worst comes to worst, contact me directly by email, certainly. I'll be happy to help out. So let's begin with the syllabus. I'm going to pull the syllabus up in just a second here, and I'll share my screen. I'll go back and forth between sharing the screen and sharing video. So here's our syllabus, and this will all be available to you in the course shell. Make sure you take the course syllabus quiz. You need to take that in order to get access to all the course information. Here are the learning objectives. I'm not going to read these over now. They're pretty self-explanatory. The one thing I'll say about the project for this course, the course readings are heavily focused on non-communicable diseases, but don't feel like you have to use non-communicable disease, NCD, for your project paper. I'll give some examples of the many kinds of topics you can address. When I say make an integrated behavioral health specific, that means addressing a medical and behavioral or lifestyle issue associated with the healthcare problem you're picking, but that can be very wide for many problems. So NCDs are the focus of this course because that really is a key driver for healthcare reform delivery globally now. But many other topics you can choose. I'll give you some examples in a little bit. I'll go over the two textbooks in a few minutes. Here are the assignments. They're two written assignments. You're basically going to write a proposal for doing an integrated healthcare program in an international country. And the first one is more of a literature review, problem statement. The second one is more of your methods. What's your actual proposal going to be? There are several discussion boards in the course, a couple of group activities. A group activity is a chance to join a small group. I'll assign groups and post the groups after the first week of class when all the drop ads are done. But it's a chance to meet with your peers, and typically I'll have you do a preparation for the next written assignment in your group meeting. Do like a role play presentation of where you are in your first or second assignment to get feedback both on the content, but also I want you to be able to practice making a presentation, to be able to learn how to speak with more confidence, authority, how to be engaging. Those are all things you should work on as a DBH student. The learning activities are simply little quizzes based on the course readings. They're all pretty self-explanatory based on the textbooks for the most part. They're open books, they're time limited. As long as you have a chance to read the assignments, should not be a problem doing those assignments, the quizzes. The grading policy, just in case you aren't aware, we changed over the last year in the DBH from using plus and minus grades, just using straight A, B, C, D, or E grades. So here's the grading for the course. Most importantly, I worked full-time through graduate school, so I know what a challenge that can be. If you have any kind of problem, whether it's illness, family, work, emergent problem, completing any assignment, the most important thing is to contact me or your grading instructor prior to the due date. Don't contact me on Monday after a Sunday assignment was due and say, oh, I had a problem. Contact me before the due dates and let me know what's going on. I'm very flexible in offering extensions within reason, as long as you contact me before the date. Otherwise, it gets difficult to be fair to all the students and offer any kind of late assignments without asking in advance. So please offer that courtesy to me and the grading instructor. I did post an announcement today. There'll be a second instructor, a co-instructor for this course, Dr. Sean West. I know him very well. I've taught several courses with him. He's in the military and travels often internationally. He'll be a great resource for this course. And the way the course works is I work very closely with him on the grading rubric, expectations for the course, answering your questions. I'm, of course, doing the lectures, the webinars, so I'll be the key instructor of record is my title, and I'll be the key person for the course content, and Sean will help certainly to offer feedback and grading on your work in the course. And that's worked very well historically in all my courses with him and my other instructors in the course. If you have any challenges or problems with your grading instructor, if it's Dr. West, you can certainly feel free to talk to him first. If you can't resolve it, please contact me. I'll be happy to intervene at that point and help out. The Canvas courses are organized into modules, very similar to the Blackboard modules. They're broken down in a little more detail, but here are the course schedules from now until the end of the course, July 7th. And for some reason, I can't get below this. Let me pull a different syllabus up. I always have a backup plan. Here's my Word document of the syllabus. So the first thing I want to say is I didn't have a chance to change the syllabus, but the very first sentence here for assignment 1, select a low or middle income country. I recommend that, but if you want to select a high income country for a specific reason, that's okay for this course. Let me know what country you want to pick. I went over the initial introductory comments on the first week discussion board. Let's do this coming Sunday. And one student wanted to cover Canada, one student wanted to cover Switzerland. Those are fine because we can certainly learn and take things from other healthcare systems that are, higher income, such as Switzerland or Canada, and make them relevant to the United States healthcare system. So feel free to do that. Low income is fine, but also high income is also okay. And again, integrated behavioral specific, but don't be bogged down and it must be a non-communicable disease. I'll give you some examples soon from the textbooks on many other kind of problems you can choose for this course, because I want you to follow your heart and your passion. And maybe it's going to be on something else in terms of international healthcare besides non-communicable diseases. I'll go over the instructions in more detail for the assignments. Those are the only things I want to cover right now for assignment 1. Assignment 2 is more of like a methods paper, as if you're doing a research paper. That's pretty straightforward. The discussion boards are all very clearly marked in the course. Many involve going to different websites, such as National Geographic, World Health Organization, the World Bank. Lots of great websites in the course you can look to and go to for information. So here are the 2 books for the course, by Carol Holtz, Global Health, 3rd edition, and by Burns and Liu, China's Healthcare System. So these are both great books, and in different ways. Let me cover the book by Holtz first of all, just a moment. This is the table of contents for her book, and as you can see, it defines global health early on. The first chapters are very important just to become familiar with the kind of terminology used in global health, whether it's epidemiology, social determinants of health, health inequities. We want to get a good working vocabulary for global health care. But then it dives into detail. We have a chapter 3 about developing countries, Egypt, China, India, and South Africa. A chapter on economics of healthcare, very important, because as you write your paper, I should mention the rubrics for the course from the old course did not transfer into Canvas. I need to write them over again. And I'm going to make them a little more clear, especially for the assignment 1. I want you to really focus on, for the issue you pick for your paper, the different contexts of the problem. There's certainly epidemiological context. What's the problem you pick? What's the epidemiology? What are the consequences of the problem in terms of health? What are the healthcare system issues in the country you picked regarding that problem? What are the politics in terms of healthcare for that problem? So I want to give you more details on how to approach these problems. But certainly economics is a key one. Whatever problem you pick, you want to spend some time talking about impact on cost, on quality of life, disability, things like that. And then some of the topics covered in this is a chapter on human trafficking, a key issue globally, and as well as here in the United States. A chapter on social determinants of health, which you should all be familiar with now. Chronic disease, cardiovascular disease, later on covering diabetes, respiratory disease, nutrition, environmental health, occupational health. There's some nice chapters here about social work practice, and then different age groups, reproduction, infants, children, older adults. So these are all possible areas for you to pick for topics. It could be a specific population, it could be a particular issue. And integrated behavioral health means you're addressing both the medical, social, behavioral, and lifestyle issues that may be associated with that particular problem. Let me stop there for a moment. Any questions from those who are on the course now? Very good. So the other course textbook is on healthcare reform in China. Even though you may not be interested in China per se, it's certainly an area of great expertise for me personally, as well as Southeast Asia. And this book is also a fantastic book in terms of addressing healthcare in a specific country. It's fairly recent. It was published in 2017. And it's just a great example of how to write about global health. So as you write your papers, look at how this book is written and use some of the same approaches. And in particular, I'll give you examples right from how the book is organized. Part 1, the framework, history, and public health. You can do a brief history of how the problem was addressed in the country you picked. What's the current issue in terms of healthcare reform in your country and how it impacts the problem you picked? What are some of the challenges for the country and why did you pick the problem in terms of the country you picked and the healthcare issues it faces? Almost every country is going through continuous healthcare reforms. That's going to be a key topic you have to address in your paper. There's a great section here on healthcare providers, the workforce. This covers physicians and nurses, hospitals. Gives a case example of United Family Healthcare, an international Western company in China for hospital care. And then a section on financing elder care, which is a huge problem globally. As the population ages, there's a great need to address the healthcare needs of the elderly, and many countries are not prepared for that. They're ill-prepared, ill-equipped. It's a major challenge for all of them, especially in China. A section on insurers and reimbursement. Whatever country you pick, is there insurance? How does it work? Who's covered? So great section here on the emerging insurance reform in China. Product manufacture is also critical. Pharmaceutical industry is key in any country, right? Oftentimes in these different low-income countries, the first only line of treatment is medication. There is no behavioral health consultant. There is no community health worker. Physicians and nurses are in short supply and facing high patient caseloads using medication only. So pharmaceuticals is pretty critical to address as what is the usual care in the country you're facing. And ideally, you want to try and talk about what's usual care and what do you propose for something innovative and new in terms of integrated healthcare approach to a problem in the country you choose for this course. Technology is critical because given the scarcity of human workforce resources in most low-income countries, technology can help bridge that gap. So how can they do that? Obviously, things like using smartphone apps to help patients learn about education on diabetes, on hypertension, on medication, on behavior change, nutrition, lifestyle, depression. There's an explosion of smartphone apps globally. Every country now has them more and more available, often at no cost. Increasingly looking towards remote devices, having your blood glucose, your blood pressure, your activity level measured by an activity tracker like a Fitbit, all be measured by Bluetooth and fed back into your smartphone app. These tools can revolutionize making better healthcare available via self-monitoring, via patient self-management. I encourage you to think about what is the impact of technology in the country you pick and how can you make that part of your project for the course. So that's just really the table of contents here. And you can see just a great selection of problem areas, communicable disease, infectious disease, workforce issues, payment issues, manufacturers. I had a chance to read again for those who posted. The week 1 discussion board is not great. It's just an introduction. I did add an assignment to look at the World Health Organization website and browse around different countries there and try and think what country you want to pick. And there's no particular rationale I expect you to follow. It could be a country you've taken a vacation in. It could be a country you have a passion for because you read about it, or a place you are from originally. You have relatives who are from that country, ancestors from that country. So make a choice and try and identify a problem that you can find a solution to, an innovative solution, integrated care solution to the problem in that country you're facing. And I'll guide you in the course as we go through different readings how to shape your paper, address your paper. I want to cover some of the readings in week 1, how I address readings in this course. Before I do, let me hear from some of you. Let me hear from a few of you just what your initial thoughts are for the country you want to pick. If you have any thoughts yet about the kind of problem you want to address in the country you're picking. So please, how about some folks stepping forward and unmuting and talking for a bit. And share your camera too if you don't mind.
Hi, everyone. This is Mary Warner, and I'm calling from Boston. I don't know if my camera works right this second, and I'm in the dark. So
That's okay if it doesn't work, Mary. No worries.
Yeah. So I'm interested in and I'm wondering if this fits the assignment. I've done a lot of work in Uganda, working with trying to increase capacity to care for non-communicable diseases. But something that I've come upon is that there seems to be a cultural misunderstanding, or I don't know if this is I'm not sure actually if it's a health literacy issue or not, but there tends to be a belief in the culture that diseases can be cured by a 10-day course of antibiotics, and that there aren't really, the notion of chronic diseases is not well understood. And this is more of a sociologic problem, so I don't know if it fits the criteria, and I was just curious what you thought of that idea. But specifically, I'm thinking of an intervention that could help educate the public about the idea that there are different kinds of diseases, and since the focus has been mostly on HIV, malaria, and other infectious diseases, that there are other diseases besides that, and those are not cured, essentially with a 10-day course of antibiotics.
That's a great topic. And two things, Mary. I had a chance to read your introductory post. I'd like to have you give a talk at some point, not today, but later on in the course about the work you're doing. It sounds fantastic. So I'm really looking forward to hearing more about that. And in terms of the topic, yes, that's a great topic. I'll give you an example. I was just engaged as a consultant to develop a psycho-oncology program for the National Cancer Hospital in Hanoi, Vietnam. And in doing my homework, both talking to colleagues and doing meetings, I came across interesting cultural issues like the ones you're bringing up. So, for example, in Vietnam, talking about death is avoided. So oftentimes the family prefers not to tell the patient when they're diagnosed with cancer. Also in Vietnam, because of a lack of education about early warning signs of cancer, about the need for screening, the great majority, 70% or more of all the cancer cases in Vietnam are diagnosed at late stage and are incurable at that point. So it's a great example of if there was education available, it might help again impacting that, right? So I further learned that there's often discomfort among physicians and nurses talking about death with patients. And obviously, from Western perspective, that's a big problem. If you want to talk about palliative care and preparing for end-of-life issues, a major barrier there. How do you address these things? What's the right answer? I'm not sure of that, but being aware of these cultural differences is critical. Then I read how Buddhism is, about 50% of the population in Vietnam is Buddhist, and one common Buddhist belief is that if you have a disease like cancer, it's because you did something bad in your life and deserve that. So stigma, shame issue is also compounded here. So I bring these up an example, Mary, because they're all very similar to what you're bringing up. Things that are cultural beliefs, very strongly embedded in the culture, that are likely harmful in terms of health outcomes, right? You have to respect cultural beliefs, but also move folks into understanding the need for screening, early diagnosis, early treatment, and in your case, the need for more than this antibiotic regimen as an approach to illness. So what are some thoughts you have, Mary, about how you're going to address that problem?
That's a good question.
You didn't give an answer in the first class. So don't feel pressure. If you aren't sure yet, that's fine.
I actually would like to read a little bit more about this. There has been a transformation even in our thinking in the United States, because at the time in the 50s, when there weren't really that many medications to care for chronic diseases, the notion of chronic disease management was not known and understood. And certainly by the mid-90s, that became part of our lexicon. So I would actually like to study a little bit more on from what happened in the United States, just to understand how the transformation occurred and what innovations worked to try to communicate that change and the difference, and maybe see if there's something that would, talking with some Ugandan partners, are there comments or topics that we use to help change our cultural beliefs, to see if we could come up with something that would be Ugandan-centric and work in that same way.
That's a great combination. For any kind of problem I address when I work internationally, I do that same 1-2 combination, Mary. Number one, what's the existing research I can learn from the United States, or if it's been done in the country I'm focused on, what's the research there? And secondly, asking, colleagues, or even I'll just often do cold call emails to research publications I've seen who address the problem internationally and ask for their advice or feedback. And most people are very generous giving their time. in your case, you have certainly contacts already from your work there, it sounds like, Mary, to tap into. But that combination of doing the homework first, what's the research, U.S.-based best practice, what's being done in your case in Uganda, and then asking colleagues for advice. That's a great way to start.
Great. Thank you so much.
And thank you for the introduction there. I see a comment from Shasa. I don't like Canvas. It's so confusing. Anything new is always confusing at first, Shasa. So hang in there. I was confused first, and I spent over the last 2 weeks many hours watching tutorials and reading and going back and forth. And I think in the end it'll be fine. But any learning curve is a challenge. Hang in there. We'll get through it together. Hopefully with no PTSD in the end. Other folks, I'd like to hear from more of you who are online now about the country you're thinking about and or the problem you're thinking about.
Dr. O'Donnell, this is Mary in Georgia. I'm the other Mary.
Looks nice there.
Yeah. I've been looking at cardiovascular disease and how it has increased in the sub-Sahara. And I was especially looking at it from the standpoint, I looked at the fact that it increased considerably among U.S. African Americans. And I wanted to see what the relationship is. Is there, does it occur as much or greater in the sub-Sahara? My problem was choosing which country in the sub-Sahara. I especially look at Ethiopia because it had, because of the population, the large population. And I was looking at South Africa, both from the standpoint, I looked at the amount of money that's spent in Ethiopia for healthcare, and I looked at life expectancy, and I compared it with South Africa. So right now, I'm kind of stuck trying to figure out which country would be a better country, to choose from. South Africa, they spend more money on healthcare, but their life expectancy is lower. Mm-hmm. So that's where I'm kind of stuck right now. I'm not sure how to differentiate between which is a better country to choose from, because it's affecting the majority of the countries in the sub-Sahara.
Mm-hmm. Well, there's no instructor answer to that question, unfortunately. Which country to pick? Africa is a big country with many nations, and they all have unique aspects for them. A couple of ideas. One is to use the hallway conversations equivalent in Canvas, because we have at least 2 or 3 students who are from Africa, and we'll probably give some feedback from their experiences to help guide you on that question. Looking over my notes here, 2 students are thinking about doing Nigeria already in this course.
I thought about Nigeria, and I pulled it back because there were a couple of people that were going to do Nigeria.
Yeah, I mean, you can either do a same one or different. It's up to you. I think doing something different would be nice from my point of view, so I can learn more about different countries from your work rather than doing the same thing. I'll also just say, for those interested in any work in Africa, I'm doing most of my work, and I'll describe that soon, in China and Southeast Asia. But a couple of years ago, I worked with one of our DBH students when he was graduating. His name is Albert Managna. He's from Zambia, and he had all kind of connections in Ministry of Health there, and wanted to try and get a proposal together for integrated behavioral health in Zambia. And another student in this class, Florence, approached me a few months ago saying she wanted to try and find a real project to work on in Africa. So I connected both of them. I'm going to try and help them put forward a real proposal to do integrated behavioral health in Zambia. Not for this course. If you want to get involved in that project, any of you, let me know. I'll be happy to have you join. We need more help, more resources. It's a kind of DIY project. So keep that in mind. It's going to be focused on Zambia because Albert has many contacts in the government there. We need that inside track to have any traction, of course. Don't use that to pick your project for this course. It's more just an FYI if you're interested in doing work in Africa that might lead to a grant or other kind of funding down the road. But back to you, Mary. I would just say, browse around looking at World Health Organization, do some Google searches, and just find which one you're most interested in. What country is most fascinating, interesting to you? Where's the need greatest for the kind of problem you want to address? Where's the balance between not enough resource to do anything, it's not realistic, or so much it's not going to be really helping much, right? So try and pick out the sweet spot based on the kind of problem you want to address. And last of all, going back to your question about comparing U.S. to a sub-Saharan country, that's fine, of course. Your paper would focus more on the actual country you pick rather than the United States, but a comparative analysis, what are we doing here that's best practice versus there, would be helpful.
Right, okay.
That helpful, Mary?
Yes, yes.
I know you want a direct answer from me. You want me to say, pick this country, but I'm not going to do that for you.
No, because I was also looking at the SALT project where they are limiting, they've established laws to limit the amount of salt use in different countries. And that's supposed to have an effect on reduction of cardiovascular disease. So
Sure.
It was just a matter of trying to figure out, just, I guess I'm just being indecisive. But,
That's okay. And week one is fine being indecisive. You have till next week to figure out something. So,
and it doesn't matter if it is low to middle or high income countries.
it doesn't. I think, from my point of view, the need is greatest in low income countries.
Okay.
And I think if you want to be a consultant, that's where the opportunity lies.
Okay.
But if you have an interest in a high income country because there are some things being done, for example, in Canada or Switzerland that are excellent, maybe we should import to US, Australia. If that's your focus and interest, I won't, stop you from doing that. But if any of you want to do consulting in the future, consulting is very highly penetrated in the upper middle income countries. There's tons of companies with deep pockets doing work there. If you want to be a consultant and go out to Africa, South Asia, that can be something you realistically do in your future without having to have deep pockets and launching yourself that way. So it's more of a pragmatic issue. And again, the need is so great because these countries are struggling with lack of resources and innovation is needed. And I look to DBH students as being innovation leaders and look forward to your work in that regard.
Okay. All right. Thank you.
Thank you, Mary.
Hi, Dr. O'Donnell. I missed you a little bit.
How are you doing? Good to see you.
Okay, so I'm a little bit behind. I haven't done anything. I literally just flew in today, and my books literally was on the front step when I arrived home today, so I haven't read. But I started watching some of the videos. Some things that have been intriguing to me, of course, there's this whole discussion about abortion right here in the U.S., but then a lot of the information in Africa or in some countries in Africa is focusing on pregnancy and the death rates and different things like that. I guess my question is about if I were to explore something related to women who with the loss of children, and maybe because I guess it's supposed to be integrated, but how are they being treated, depression, postpartum, different things like that, trying to see some of the resources. I know that a lot of the topic is focused on the lack of medical care or the lack of ability with some medical I guess treatable diseases not being able to be treated, but also looking at how it impacts them psychologically, and just trying to see what are some of the outcomes related to that, so some of those health outcomes as well.
Mm-hmm. Well, certainly that's a great topic. Pregnancy, childbirth, pre and postpartum depression are all problems globally, and the challenge will be trying to pick your focus. But that'd be a great topic for any country you want to focus on in this course.
Okay, good, because that's what I think I'm intrigued with right now. I mean, some things I know, talking about the children, like even the second video I watched, they talked about the death rate of children under the age of 5. And I know, even thinking about adverse childhood experiences, which we already know they're astronomical in an area that's focusing on, poor economics and all of these things. So that's something else, I guess, that I'm kind of twirling between, adverse childhood experiences for children that are in a different country and how it affects them. We're noticing obviously certain demographics that are having a higher susceptibility for things like diabetes and things like that, but trying to see, I don't know how much information is actually being collected on adverse childhood experiences in substandard countries.
Yeah, well, a couple of things. First of all, just about your books, a number of students have their books just coming in now or late, and that's not going to be a problem because week one now is just a discussion introduction only. Week two is a discussion board based on a website visit, and week three is the first time you need to have the books in hand for the learning for the quiz in week three. So you should be in good shape. You can certainly catch up to the readings. There's readings each week, but they aren't critical to making progress and picking your country. Mostly your work picking a country is based on website information. It's more up to date than the books are.
Okay.
Don't worry about that for any students who are lacking the books. And the second thing that comes to mind here when you talk is about how do you pick a problem. One thing you should think about is certainly what is the best practice in the United States or a similar advanced country you think is a great way to go, and then what's feasible and what can be translated culturally, economically to the country you pick. You're not going to pick some expensive high-tech solution, high-resource solution in USA if it's not going to ever be feasible in sub-Saharan Africa. So try and really focus on how do you bridge that gap between the best practice and the best you can do in a country that's much more poor, has workforce issues. That's a constant problem, I face in doing work in China and now Southeast Asia. I have to find ways to understand the healthcare system, the culture, and offer things that are based on the best, but it's not going to be the exact same. It's got to be translated to make it more doable, more realistic, more feasible in the constraints of the country you pick. So do spend time thinking about the economics, the resources, and build something that's going to be realistic and feasible, not something that's more pie in the sky. It's never going to happen unless you have some kind of great, grant from the Gates Foundation or something, right?
Right. Okay.
The topics you mentioned are all, both medical care, pre and post delivery is a huge problem globally. Child care early in life, infectious disease, and then certainly the behavioral issues, ACEs and pre and postpartum depression are all major problems that could be helped and addressed with a good program.
Okay.
This is okay. So Shasha, sorry, I'm hoping I'm not mispronouncing the name, but I would like to say hi, Dr. Donald. I really encourage you to stay on that path. That infant mortality rate is really a huge issue in the African continent. I come from Nigeria, and the problem is most times when they lose their kids, there's really no resource there to help with the postpartum depression that these women deal with. I didn't even know that there was a name for that until I came to the United States. So I think that's a huge issue, and it will really be great to have someone sort of address that. So if you could, please stay on that path.
And thank you so much for speaking about that. I just have to share this briefly, but my first semester in the doctorate program, I actually was in Aruba, and I found out that I was pregnant on a cruise ship, and it was an ectopic pregnancy, and I ended up being in the hospital in Aruba for like 7 days. It was a very traumatic experience, but I'm saying that to say after leaving Aruba and returning to the States, and obviously, I'm in behavioral health, so I understood the emotions that I was experiencing and things like that. And I can't imagine having suffered such a loss without the right resources and support. And so that was another reason why it was so intriguing to me. So thank you so much for kind of confirming that I should stay on that path.
You're welcome.
Thank you both. Anybody else want to speak up about the course, the topics they're looking at, the countries or topics they're looking at? It's great to hear from you all.
I guess I can go next. Sorry, I can't share my camera right now. But I'm the other student who's doing Nigeria, and I'm doing that because, of course, that's my country of origin. And unfortunately, I had a negative experience when I was back there with my dad suffering from a stroke, and unfortunately, being a victim of that, and coming to the United States and working in the chronic disease space, I'm seeing that some of the things that he had gone through or passed through at the time could have been prevented or even avoided if we had the resources, not just on the chronic disease side, but also the resources to help him deal with the negative emotions that came with his inability to be who he was prior to the stroke. So I'm really interested in looking at how to manage that stroke and depression. And just as a result of this assignment, I was able to go in and do a quick review, and I realized that some Nigerians are already somewhat working in this space, trying to see how they can use primary health care workers to implement some sort of behavioral therapy in our general hospitals, which is kind of like the primary care clinics here in the United States. So I'm really looking to explore that a little bit more in this course.
That sounds great. Anybody else want to go? You don't have to talk if you don't want to today, but I encourage you to. I like discussion like this. Very helpful. Anybody else? Okay, I'm going to share my screen and go over some of the readings in this week, because I have a lot of readings in my course, and I want you to freak out and think you have to spend the next 20 hours reading all these different things I put out there. I'll explain what readings are important, how to really address skimming some of the things, picking up key items you'll need for the course. Let me share my screen again and go over some of the readings here. Give me a second to find them. Okay, almost ready here. Hang with me. So I'll start here. This book is kind of dated now. I think it's like maybe 10 years old, but it's one of the only books published on integrated behavioral health in primary care from a global perspective. And it's got just some fantastic case studies on efforts to integrate behavioral health globally. So a key theme is, how do you address improving healthcare and primary care? That's the focus of the United States, right? And integrated behavioral health and primary care is the hot area and the key area of healthcare reform. These are all examples of this in other countries. So you can see from the table of contents here, we have examples from Argentina, Australia, Belize, Brazil, Chile, India, Iran, Saudi Arabia, South Africa, Uganda, and Great Britain. So this is more, again, not to read in detail, but to skim, look for examples of what's being done in different countries to adapt primary care. Really interesting reading. Don't read every single chapter. You can skim this and pick ones of interest to you, right? This is an article simply about the importance of primary care and global health. It's really lacking. It's, in USA, it's kind of assumed that's where all the action is for chronic disease management and prevention. It's really lacking internationally. This is a nice introductory article to that. Here's an example, just things you can find online. We're all taught to use PubMed for our literature review searches to find research articles and publications. I certainly also go by that. But at the same time, you can often find really interesting things just doing Google searches for the countries you're interested in. So I found this Ministry of Health publication about Thailand, just summarizing the healthcare system there. And Thailand is unique because it's one of the few countries in Southeast Asia that adopted universal health care, I think over a decade ago, and a pretty robust system with taxation to support good care. So it's actually far above neighboring countries in terms of integrated care and primary care in general, health care. So it's just an example of what you can find online with a quick search. Again, you can just look this over and get a sense for what's happening in Thailand. This might be of interest to you. It's I found this kind of just searching also. It's a international healthcare toolkit by the National Association of Community Health Centers. I'm not deeply familiar with this organization. I'm not sure if any of you are, but it certainly is a way to open the door to doing work internationally if you'd like to through this organization in community health centers. So you can look this over, think about it as something you want to pursue. The toolkit is very nice. The different kind of tools you can use to address global health, health centers abroad, what's going on in those health centers, what it takes to go global. So as you're looking at your paper and trying to develop how to do it, this might be a useful resource for your paper. This is a nice look at what the U.S. is thinking about in terms of global strategy from the U.S. Department of Health and Human Services. I think it's a fairly recent publication. Find a date here. Go to the table of contents. It really summarizes from our perspective, West perspective, the key objectives in terms of global health, what the priorities are, what the strategies are. So it's an easy read, a nice read. It's not too long. If you want to get a perspective from the U.S., I recommend skimming through this also. And of course, in the United States, you're hearing more about value-based care as a part of healthcare reform. That's not going to be as evident in low middle income countries, but it is now coming into play there. Basically, value is defined as what is the quality and outcome of care divided by the cost. So obviously, the more you can have high quality, good outcomes at lower cost, that's ideal for emerging countries, right? So you want to find interventions. Maybe you can get away with doing a health worker guided smartphone app for postpartum depression, and that would be much more effective than having a psychiatry-based program for the same problem, right? So you want to look at value-based care. Any country you pick, you can search to see if anything's happening in value-based care yet. It may not be in the country you pick. That's okay if it's not, but this is really key for healthcare reform and payment. The reason it's so important is that the United States, one reason primary care, prevention, disease management is so common now. We're seeing so many behavioral consultants, both clinicians and managers being hired and transforming their workforces because our government decided to pay for those services, right? We're paying for prevention, for integrated behavioral health. It's still imperfect, a long way to go how we're paying, but there's payment now. So for other countries to move in this direction, they're going to have to find some way also to restructuring how they pay for healthcare, because in many countries, the combination of just lack of economic resources and lack of innovation, ideas how to be more creative to apply resources are real barriers you have to face in the countries you pick, and value-based care will be a solution long term. This is a really interesting and important World Health Organization document on preventing chronic disease by the World Health Organization. This is very long, but very important if you're interested in chronic disease, as you should be. This covers why it's important, the call for action, epidemiology, the causes of NCDs globally, interventions that work globally, and action steps you can take. So I recommend looking at this more closely, not just skimming this, but looking over this carefully and reading some of the key content in this WHO publication. This is an article I found just online on China's healthcare reforms. It's a nice summary if you want to look at this. Our book really covers this in detail also, so this is not a critical reading, but it gives you a chance to see what's really happening in terms of their healthcare coverage. They've expanded their healthcare coverage tremendously, which is a great thing, but the quality of coverage, meaning what it actually covers, is still subpar. There's still great problems with lack of access to quality care, with people going bankrupt because of illness in China. So it's good to see the progress, but it's a long way to go. I actually was searching and found a more recent version of this article I'll post next week. But a quick view of China for those who are interested in that country. This is more about a global approach to prevention and control of NCDs. And this is a task force on global health crisis. Who is this by? Council on Foreign Relations, another big player. So again, similar to the World Health Organization document, a great resource. Let me find a table of contents for you here. Looking at the role of U.S. leadership and engagement from this perspective. And also I attached an annex report, additional detail This simply has, for I think 50 countries, snapshots of their key health status. Let me scroll down and show you. So it goes through a very quick snapshot of priority countries. One thing I'll say, by the way, in terms of writing your papers up, I encourage you to look for and use graphics like this to highlight trends, epidemiology, etc. You can simply copy and paste and cite the reference. If you're doing an actual publication, you have to go to the original author and ask for permission. But for the purpose of this course, if you simply wanted to cite where the graphic came from, that'd be fine for this course. Because graphics really can tell a big story. I'm a big fan of visual design, meaning how can you use graphics to convey information very clearly? These are great examples of that. These are very clear ways of looking at changes in NCD deaths and DALY, disability adjusted life years over time. So feel free to use graphics as relevant in your papers, all right? That's all I wanted to cover for readings, I think. Yes, that's it. So that kind of winds down all I wanted to cover today. This is going to be an exciting, fun course. I hope you enjoy it. Hope you have a chance to immerse yourself and be creative, innovative. Look for the evidence. Try and then look for how you can find out about care in the country you're focusing on. Use PubMed, use Google. Try and find firsthand accounts, newspapers, interviews. Those are often ways to get to the individuals providing care in the countries rather than just researchers who often a step removed from the actual care being delivered in the trenches. So be creative and comprehensive in how you try and find information. If I have contacts I can think of for you, I have many contacts obviously in China and Southeast Asia, some other parts of the world. I'm happy to share those. Have you contact someone I know to get information about a country you're working on. You can share resources among each other in this course. If any of you have contacts you want to share from your country, if you know students working on a country where you came from, please offer to help them with contacts. A quick interview is always a great way to get more information. And again, most people in these countries who are leading healthcare efforts are often more than happy for a 5-10 minute conversation with someone interested in healthcare in their country. Let me stop there. Any closing questions or thoughts? Okay, good luck navigating Canvas. Don't get too frustrated. If you do, call the help desk. They're really good. Do the tutorials. Let me know if you're having problems. The course ramps up slowly, but then quickly. So give some thought to your projects and dive into the readings, and look forward to seeing you all same time next week. Have a good week, all.
Yeah.
Bye-bye now.